everybody, I'm Dr. Devyani and you're watching EPISTASIS. तो अगर आपने ब्लड फ्लूइड एंड सर्कुलेशन का क्विक रिवीजन वीडियोस नहीं देखा है तो जल्दी उसको देख ले। वो 3 वीडियो मैंने अपलोड किया है, 3 पार्ट में है। एंड नाउ वी विल डिस्कस जो भी क्वेश्चन नीट में इस चैप्टर से आ चुके हैं। तो ऑलमोस्ट 88 क्वेश्चंस है, तो इस वीडियो का भी 2 पार्ट होगा। सो विदाउट वेस्टिंग मच टाइम लेट्स गेट इनटू द वीडियो। फर्स्ट क्वेश्चन इज मैच द कॉलम 1 विद कॉलम 2। सो ये क्वेश्चन ECG से है, जहाँ पे P वेव, QRS वेव, T वेव तो आपको पता है। नेक्स्ट वन इज रिडक्शन इन द साइज ऑफ T वेव। सो रिडक्शन इन द साइज ऑफ T वेव इज द साइन ऑफ coronary ischemia. So the right option will be B. That means A, P wave is depolarization of atria. QRS complex is depolarization of ventricle. Number C, T wave is repolarization of ventricle, and reduction in size of a T wave is coronary ischemia. Now come to the next question. What would be the heart rate of a person if the cardiac output is 5 liter, blood volume in the ventricle at the end of diastole is 100 ml, and at the end of ventricular systole is 50 ml. So a small little tricky question. So पहले हमें stroke volume calculate करनी है. Stroke volume equals to end of diastole volume minus end of ventricular systole volume. Okay, so it will be 100 ml minus 50 ml, that is 50 ml, right? Now cardiac output is equals to heartbeat into stroke volume. So heartbeat calculate करने के लिए हमें cardiac output by stroke volume करनी पड़ेगी. So our cardiac output is 5 liter equals to 5000 ml divided by 50 ml is equals to 100. So the heartbeat will be 100 beats per minute. Right, now come to match the items given in column 1 with those in column 2 and select the correct option given below. Tricuspid valve, bicuspid, so tricuspid valve between left atrium and left ventricle, bicuspid valve between the right ventricle and pulmonary artery. So ये wrong है. Semilunar valve between right and heart. So for right option will be 3. Right option will be A. That means A will be 3. That means tricuspid valve is between right atrium and right ventricle. Number 2, that means bicuspid valve equals to is meaning between left atrium and left ventricle, and semilunar valve between right ventricle and pulmonary artery. Right, now match the items given in column 1 with those in column 2 and select the correct option given below. Okay, so number 1 is fibrinogen, number 2 globulin, and number 3 albumin. ये सारे ही blood में पाए जाते हैं, and the right option will be D. That means A will be 2. fibrinogen क्या करता है, clotting में help करता है, तो blood clotting करेगा. Number 2 is globulin जो defense mechanism में help करता है, and albumin करता है osmotic balance. So right option will be D. Now adult human RBCs are enucleate. That means उसमें nucleus नहीं होते. Which of the following statements is are most appropriate explanation for this feature? Number 1, they do not need to reproduce. They are somatic cells. They do not metabolize. And number 4 is all their internal space is available for oxygen transport. So right option is only 4. That's all their internal spaces are available for oxygen transport. Okay. Next is the hepatic portal vein drains blood to liver from stomach, kidneys, intestine और heart. So mainly आंसर ये आपके बुक में intestine है, लेकिन कहीं कब ये stomach से भी blood ले जाते हैं. So right option can be A or C. Next is C. Number 7, name the blood cell whose reduction in number can cause clotting disorder leading to excessive loss of blood from the body. So right option will be thrombocyte. So ये help करता है clotting में. Next, serum differs from blood in lacking clotting factors. We know blood minus clotting factor, that means plasma minus clotting factor equals to serum. So lacking clotting factors, not globulin, albumin or antibodies. Next is blood pressure in the pulmonary artery is more than that of pulmonary vein. So this is the character of pulmonary artery. That is, their pressure is more than that of pulmonary vein. Right. Next question number 10 is in mammals, which blood vessels would normally carry largest amount of urea? ओके, सो यहाँ पे हेपेटिक वेन जो है वो लार्जेस्ट अमाउंट ऑफ यूरिया अब्सॉर्ब होके हेपेटिक वेन के थ्रू जाता है, तो दैट इज द मेन राइट आंसर, दैट इज हेपेटिक वेन. Next is, which of the following animals has two separate circulatory pathways? That means double circulatory pathways होते हैं. Whale, shark, frog and lizard. तो mammals में होते हैं, तो right option will be whale. Next is, doctors use stethoscope to hear the sound produced during each cardiac cycle. So the second sound is heard when semilunar valve closes down after the blood flows into vessels from ventricle, that is dub. Okay, so ये semilunar valve बंद होने की आवाज है, तो right option will be D. Erythropoiesis starts in spleen, red bone marrow, kidney or liver. Right option will be B, red bone marrow. Which of the following is correct? Lymph equals to plasma minus RBC minus WBC. गलत है. Blood equals to plasma plus RBC plus WBC plus platelets. So ये right option है. Plasma equals to blood minus lymphocyte, ये गलत है. Serum equals to blood plus fibrinogen, ये भी गलत है. Next question 15. Blood pressure in the mammalian aorta is maximum during systole of the left ventricle, diastole of the right ventricle, systole of the left atrium, diastole of the right atrium, right ventricle. So इसमें aorta में सबसे ज्यादा प्रेशर कब होगा? जब systole of the left ventricle होगा, right? Next is, person with blood group AB is considered as universal recipient because both A and B antigens on RBC but no antibodies in the plasma. So nothing to see about this other option. Right option will be A. Next question, how do parasympathetic neural signals affect the working of the heart? It reduces both heart rate and cardiac output, right? So parasympathetic neural segment reduce करता है, sympathetic neural segment increase करता है. Next question, the given figure shows schematic plan of blood circulation in humans with level A to D, A, B, C and D. Identify the level and give level and give its function. Okay, number C. Okay, so this is number C. It is vena cava, takes blood from body parts to right auricle. So this is and the pressure is of PCO2 is 45 mmHg. तो ये figure आपकी book से ही है, and C is the right option. D is dorsal aorta, takes blood from heart to body parts, ये गलत है. And A, pulmonary vein takes impure blood from body parts, ये भी गलत है. And number B, pulmonary artery takes blood from heart to lungs, ये भी गलत है. And इसके साथ आप लोगों को pressure भी, partial pressure of oxygen भी check करनी है, right? Next is 19. The diagram given here is the standard ECG of a normal person. The P wave represent beginning of systole, end of systole, contraction of both atria. So joint and systole को ही P दिखाता है. Initiation of ventricular contraction, no. Right option will be A. Next, the figure shows blood circulation in humans with levels A to D. Okay, A, B, C and D. And with select the option which gives correct identification of the level and functions of the part. Okay, so ये figure भी आप लोगों की book से है. Number B is capillary and it is thin walled muscle layer and wall 2 cells layers and and 2 cell layers thick. So ये गलत है. Number C is vein, thin walled and blood flows in jerks. No. Number D is pulmonary vein, takes oxygenated blood to heart and इसका pressure है 95 mmHg. This is the right option. A is thick walled and blood flows evenly, ये भी गलत है. Next question is 21. The figure shows human blood cell. Identify the given give its characteristics. So it is blood cells and it is basophil. Characters is secrete serotonin, inflammatory response show करता है, right? Not B lymphocyte, neutrophil or monocyte. So जो picture है वो basophil का है. Next, a certain road accident patient with unknown blood group needs immediate blood transfusion. His one doctor friend at once offers his blood. What was the blood group of the donor? Donor का blood group क्या होगा? वो universal donor होगा, obviously क्योंकि उनका blood group हमें पता नहीं है, तो the right option will be blood group O. Now, which of the following human organ is often called as graveyard of RBC? It is spleen. Okay. Next is bundle of His is a part of which of the following organs in human? Brain, heart, kidney or pancreas. So right option will be heart. Which one of the following plasma protein is involved in coagulation of blood? Albumin, serum amylase, globulin, fibrinogen. Right option will be fibrinogen. Arteries are best defined as the vessels which supply oxygenated blood to the different carry blood away from the heart, because pulmonary artery different काम करता है, so carry blood away from the heart to different organs. So mainly it is artery best defines as this B option. Next, which of the following statement is correct regarding blood pressure? 130 by 90 mmHg is considered high, requires treatment. 155 is considered an ideal blood pressure, wrong. 105 by 50 makes one very active, no. 190 by 110 of mmHg may harm vital organs like brain and kidney. So this is the right option, right? Next, a person with unknown blood group under ABO system has suffered much blood loss in an accident and needs immediate blood transfusion. His friends who has valid certificate of his own blood group offers for blood donation without delay. So what will be the type of blood group? Same question, it will be type O. Given below the ECG of a normal human, which one is component is correctly interpreted? Complex QRS, one complete pulse. So we have to calculate the number of heartbeat by calculating number of QRS complex. So this is the right one. Peak T is initiation of total cardiac contraction, wrong. Peak P and peak R together systolic and diastolic blood pressure, no. Peak P initiation of only left atrial contraction, ये भी गलत है. If due to some injury the chordae tendineae of the tricuspid valve, so just remember the function of tricuspid valve of the human heart is partially non-functional, what will be the immediate effect? अगर tricuspid valve ठीक तरह से काम नहीं करेगा तो क्या होगा? Backflow होगा. The flow of blood in the pulmonary artery will be reduce होगा. Number A is the flow of blood in the aorta will be slow down नहीं होगा. Next is the pacemaker will stop working, nothing to do with pacemaker, तो ये गलत है. The blood will tend to flow back into the left atrium. Okay, so ये वैसे भी बंद हो जाता है tricuspid valve से, so the flow of blood into the pulmonary artery will be reduced. Okay, so this is the right option, क्योंकि जो ये chordae tendineae है ये tricuspid valve को ठीक तरह से फंक्शन करने में हेल्प करता है, एंड इससे ये अगर डैमेज हो जाएगा तो फ्लो ऑफ ब्लड टू द पल्मोनरी आर्टरी विल बी रिड्यूस, क्योंकि वो ठीक से बंद नहीं होगा और प्रेशर उतनी फॉर्म नहीं होगी, और ये आर्टरी विल बी दिस पल्मोनरी आर्टरी में जितना ब्लड जाना चाहिए उससे कम जाएगा. Next is which two of the following changes 1 to 4 usually tend to occur in plain dwellers when they move to high altitude? Number 1, increase in red blood cell size. Number 2, increase in red blood cell production. Number 3, increase in breathing rate. Number 4, increase in thrombocyte count. So right option will be 2 and 4. That means increase in changes occurring are 2 and 3. Yes, increase in breathing rate ये तो होगा ही immediate effect, and उसके बाद mainly increase in blood cell red blood cell production भी ज़्यादा हो जाएगा, क्योंकि उसमें ज़्यादा ऑक्सीजन कैरी कर सके इसलिए. So 2 and 3 will be the right answer. Next, fastest distribution of some injectable medicine and with no risk of any kind can be achieved by injecting it into the muscle, arteries, veins or lymph vessels. Mainly lymph, intravenous injections हम देते हैं. Next is given below are 4 statements regarding human blood circulatory system. Arteries are thick-walled and have narrow lumen as compared to veins. Angina is acute chest pain when blood circulation is to the brain is reduced. Persons with blood group AB can donate blood to any person with any blood group under ABO system No. Calcium ion plays a very important role in blood clotting. It is rare. Which of the statements are correct? 4 correct hai. Between A1 and 2, arteries are thick walled and have a narrow lumen comparative to veins. So this is the right option. Angina, brain में blood circulation ठीक नहीं होता, इसलिए नहीं होता है, right? Next, the hemoglobin contained per 100 ml of blood of normal healthy human adult is 12 to 16 mg. There is no DNA in mature RBC, a mature spermatozoa, hair root, or an enucleated ovum. It mainly mature RBCs, right? Next is, in a standard ECG, which one of the following alphabet is the correct representation of the respective activity of the human heart? तो ECG बहुत ही important है, इसको अच्छे से पढ़ना है, right? क्योंकि बहुत सारे question ECG से आता है. S is start of systole, T end of diastole, P is depolarization of atria. So this is the right option. Only R is depolarization of ventricle. ये गलत है. Globulins contained in plasma, human blood plasma, are primarily involved in osmotic balance of blood fluids. नहीं, ये albumin करता है. Oxygen transport in the blood, ये भी गलत है. Clotting of blood, fibrinogen करता है. Defense mechanism of body में help करता है. Globulins, the right option will be D. Compared to blood, our lymph has plasma without proteins, more WBCs and no RBCs. So lymph में RBCs नहीं होते हैं. Next, more RBCs and less WBCs, ये गलत है, and no plasma. So ये भी गलत. So right option will be B. In humans, blood presses from the post-caval to the diastolic right atrium of heart is due to the pressure difference. Mainly, जो भी blood pass होगी, mainly pressure difference से ही होता है. So pressure difference between post-caval and atrium. The most active phagocytic white blood cells are neutrophils and monocytes. They are very active phagocytes. Which one of the white blood cells are concerned with the release of histamine, natural anticoagulant heparin? So it is basophil. A drop of which of the following is placed separately on 4 slides? Which of them will not coagulate? Blood serum, इसमें fibrinogen नहीं है तो coagulate नहीं होगा. Sample from thoracic duct and lymphatic system होगा. Whole blood from pulmonary vein होगा. Blood plasma. So सब में ही blood coagulate है, but clotting factor है blood serum को छोड़ के. Next, which one of the following has an open circulatory system? Octopus, Ferritima, Periplaneta and Hirudinaria. Right option will be Periplaneta. You are required to draw blood from a patient and to keep it in a test tube for analysis of blood corpuscle and plasma. That means we do not allow it to coagulate, or we have to keep it as it is, right? So so you are also provided with 4 different types of test tube. Which of these will not use for this purpose? Test tube containing calcium carbonate. Chilled test tube should be used. Test tube containing heparin, because हमें anticoagulant चाहिए ताकि coagulation ना हो. Test tube containing sodium oxalate में help करता है, तो ये भी चाहिए. Will not use for this purpose is test tube containing calcium bicarbonate. Now the cardiac pacemaker in the patient fails to function normally. The doctors find that an artificial pacemaker to be grafted to him. It is likely that it will be grafted at the site of. Okay, so this question is not complete. So it will. Just a minute. It will. Okay, so a site of atrioventricular bundle, Purkinje system, sino or atrial node, or atrioventricular node. Okay, so in से correct answer. So we will discuss number 45 in the next video. So till then number 44. So total 88 questions are there. So we will discuss till 44, and this we will start the next video from this particular form number 45 question. So if you like my videos, please do subscribe to EPISTASIS and hit the like button. So till then, take care and bye bye.